Hi, it's Georgie, and this is Fempower Health Audio Insights, where I break down the biggest issues in women's health so you can navigate the system with confidence. Whether you're a patient, policymaker, or provider, these insights give you the power to make informed decisions. And today's piece is an important one. We're going to talk about compounded medications, what they are, when they're helpful, and why so many women are turning to them for everything from hormone therapy to GLP-1 medications like semaglutide. You've probably seen the debates. Big pharma versus compounding pharmacies. People claiming creams save their life while others are waving red flags about safety and regulation. It's confusing, and honestly, a lot of the conversation out there is loud, polarizing, or market-driven. This episode is my attempt to slow it down, cut through the noise, and walk through what we actually know based on research, patient stories, and industry realities. If you're here, it means you care about making informed decisions about your health, and that matters. And if someone in your life is navigating perimenopause, PCOS, weight changes, or hormone therapy, share this with them. These are the kinds of conversations we need to be having more often, without shame and without spin. All right, here's what you need to know. Since supporting women in their perimenopause and menopause years has quickly shifted into big business, the conversations on social media and in the press are louder than ever, often at odds with each other, and ultimately drive fear and chaos. Not only was the debate, is hormone therapy good or bad for you, but it also extended into who makes the product, big pharma versus compounding pharmacies. The weight loss medication shortage further fueled this debate. It's hard to make informed choices when the messaging is chaotic. I wanted to step back and take a more grounded, even voice, cutting through the noise of headlines, social media, and clickbait to focus on what women actually need to know. And while this conversation often centers around menopause, many women use compounded medications for a range of issues, from PCOS to progesterone intolerance to vulvar conditions. The stakes go well beyond hot flashes. Millions of women are using compounded hormones, often because they haven't found success with other options, and yet these medications aren't FDA approved, don't follow the same quality controls as FDA approved drugs, and are almost never covered by insurance. So why are they so common? To answer that, we have to look at both the clinical gaps and the structural problems that drive people toward compounded medications, not just in menopause care, but in other fast-evolving areas like GLP-1 therapies. So what is compounding, and when does it make sense? Compounding exists to fill a real need. If a patient can't swallow pills, needs a lower dose than what's commercially available, or has an allergy to a dye or filler, a compounding pharmacy can make a custom version of a drug. There are scenarios where this makes a meaningfully difference in care. We saw this clearly during the national GLP-1 shortages. When drugs like Ozempic and Wegovy were unavailable, the FDA permitted compounding pharmacies to make semaglutide formulations. But that permission was temporary, tied directly to the shortage, and yet many pharmacies continued offering versions of semaglutide even after supply stabilized. That shift created a gray zone. Some compounds were made with salt-based versions of semaglutide, sodium or acetate, which are not the same as what the FDA originally approved. In many cases, patients were unaware of the difference. Some were unaware they were taking a compounded product at all. This was outlined in the FDA public guidance. And if you go to the blog version of this episode, you can check out the link there, and also in the show notes. This mirrors the situation in women's health. So let's talk about the rise of compounded hormones in menopause care. An estimated 1 to 2.5 million women in the U.S. over the age of 40 are using compounded hormones. Many say they've tried everything else, patches, pills, rings, and found compounded creams or pellets to be the only tolerable option. Others are told that compounding allows for more precise dosing or bioidentical formulations tailored to their hormone levels. But here's the reality. Compounded hormones are not FDA approved. There's no standardized quality control. And lastly, the dose absorbed can vary from what was prescribed. That doesn't mean these products never help anyone. It means we can't assume they work in the way that we're told they do, and we can't evaluate their safety the way we do with FDA-approved drugs. So now let's talk about the trust, marketing, and the illusion of customization. The conversation gets more complicated when we look at how compounded products are marketed. Patients are often told their hormones are bioidentical, a term that sounds scientific but has no clinical meaning. In fact, FDA-approved transdermal estradiol and oral progesterone are also bioidentical and undergo rigorous testing for safety and absorption. The difference is not in the hormone itself, but in the process. Pharmaceutical products are manufactured in controlled environments, batch tested, and traceable by lot number. If something goes wrong, it can be tracked. That's not the case with compounded meds, where each batch is small and testing is minimal or non-existent. Some providers also promote hormone testing via blood, urine, or saliva as a way to individualize dosing. But most professional societies, including the Endocrine Society, do not recommend this practice. The testing doesn't meaningfully correlate with symptom management, and it often creates a false sense of precision. The bigger problem, a system that leaves patients scrambling. If there were more FDA-approved options, better education for providers, and consistent insurance coverage for guideline-based care, perhaps fewer women would turn to compounding, but that's not our reality. Insurance plans don't always cover FDA-approved hormone therapy. Many OBGYNs, especially those treating midlife women, are no longer in network. Some patients are left with few options that feel accessible, affordable, or effective, so they turn to what's available, compounded solutions, even if the evidence is shaky. The same situation exists for GLP-1 medications. When access breaks down, whether due to shortages, cost, or demand, patients look elsewhere. And in those moments, the lines between personalized care, systemic failure, and opportunistic marketing start to blur. On Reddit, many women echo this tension. One wrote, "My doctor warned me away from compounded hormones because the dosing can be unpredictable. I didn't want to accidentally get too much testosterone." Another replied, "That is not true. Now the compounding pharmacies use digital scales and you can ask for the receipts." Others shared that compounded medications had been the only effective or tolerable option for them, especially after trying multiple formulations without success. This mix of personal experience, uncertainty, and mistrust is what makes the conversation so charged and so necessary. So now what? This isn't about telling women what to do. It's about making sure they understand the trade-offs. Compounding can serve an important role when nothing else is available, but it should not be the default when FDA-approved options exist or a workaround that becomes normalized simply because the system is broken. If you've used compounded medications, I would love to hear from you. What worked, what didn't, and what were you told, and what did you find out later? Your story matters because the more we talk about this, the harder it becomes to ignore the gaps. If you're interested in a deep dive on compounded hormone therapy specifically, you have to go to the show notes and check out this article in 2024. You can click on it there. It's called Fear, Misinformation, and Pharmaceutical Messianism in the Promotion of Compounded Bioidentical Hormone Therapy. Thank you again for tuning in today. If this episode resonated, please do share with a friend. And I would also appreciate you following the Fempower Health podcast and writing a review, because that is how we can make sure such information gets out to the people who need it most. I will share that the feedback I get most is people are really struggling to find trustworthy information, and I am committed to giving that to you. And what's most important is I want to share balanced information so that you can make empowered decisions in collaboration with your doctor. I am not going to give you quick fixes, and I'm not going to give you one-liners. Thank you again for your support, and have a wonderful day.